Morning. My name is Rebecca Carrington. I'm a master's in social work clinical intern with Silver Linings for Seniors and Silver Linings Teletherapy. Today, I'm going to be sharing with you all a topic that's very relevant to what's going on in our current lives and in the world. I'm going to be sharing with you some information about COVID-19 and its impacts on the older adults in our communities. So let me just share my screen. Okay. So just to start off with some COVID-19 facts as it pertains to older adults. So COVID-19 has affected so many people's lives in so many different ways, but has definitely impacted older adults in particular. 8 out of 10 COVID-related deaths in the United States have been for adults aged 65 and older. The risk for severe illness with COVID-19 does increase with age. And certain medical conditions can also increase risk for severe illnesses. And what does severe illness with COVID-19 look like? So it could mean you end up in the hospital for a long period of time. It could mean that you end up in intensive care for a long time. It could mean that you end up on a ventilator for a period of time, or it could even result in death. And so these things are particularly important for our older adult population because they're already such a high risk and vulnerable population that these things could have even longer impacts than on someone who, still is younger and has their full health. So some challenges for older adults amongst COVID. So economic setbacks. So older adults will have a harder time re-entering the workforce. Unemployment rates are projected to be higher than even during the Great Depression. So with a ton of applicants, it's going to be hard for anyone to kind of get a job because everyone's going to be looking for jobs and trying to get back into work. But a big factor for older adults that most people don't have is age discrimination. So with a large number of job applicants, employers will have the ability to kind of choose the criteria that they want for their applicants, and they may potentially be influenced by negative age stereotypes and basically just remove an applicant based on their age rather than their qualifications. Also, older adults have lost a lot of their retirement savings. A recent study in 2020 showed that the full effects on their savings is still kind of unknown, but they have definitely taken a huge hit. And a lot of older adults are going to have to make up for that lost income, whether they lost a job or whether they were already retired and had to take a lot of money out of their retirement savings. So some more challenges, the health and well-being effects on older adults. So older adults have experienced a usual disruption in services. So shelter-in-place orders and the closing of organizations has prevented a lot of people from getting physical, emotional, and social needs met. Healthcare systems have narrowed their focus to managing COVID-19 cases. And this has caused a delay for other healthcare appointments and procedures. Older adults may have long-lasting emotional effects from increased isolation and anxiety. Social anxiety or social isolation and loneliness were already, factors that we were concerned about with older adults before and trying to address those issues. But now, given the COVID-19, it's become even worse. A lot of older adults who live in homes were forced to stay in their room with little to no contact with anyone other than their care providers. And so, social isolation and loneliness outside of COVID-19 were already linked to negative physical and mental health outcomes. And so it's kind of yet to see just how much COVID-19 impacts it. But we may encounter health effects for older adults that outlast their time in quarantine. The full impact on future physical and emotional well-being is yet to be determined. Older adults who have contracted the coronavirus may have increased health vulnerabilities, kind of like what we discussed on the previous slide. Ongoing complications are expected to disproportionately affect older people, and COVID-19 may cause heart damage in patients with and without previous heart problems. Another factor of challenges facing our older adults from COVID-19 includes ageism, racism, and classism. So older adults may experience stronger internal and external ageism. So a lot of countries were slow to respond to the COVID-19 because only old people were at risk. So originally they thought, oh, only the older population is at risk. We're not going to make huge plans or jump on this really quickly. And so that's really impacted the older adults in our world. Treatment protocols were more adequately developed for children and youth in certain hospitals as well. Older adults of color and those with lower socioeconomic status are at increased risk for physical and economic challenges caused by COVID-19. So older African Americans already had higher rates of morbidity and less access to healthcare before the pandemic, and that's expected to be increased. Low income older adults have less access to computers and online technologies that have eased the burden of isolation for so many people. So a lot of older adults that aren't middle class, aren't high class adults, they don't have the access to online therapy, online telehealth, online groups that they can stay connected to their community and stay connected to their friends. And so that's going to have a huge impact on them. So how do we confront these challenges? So older adults have improved their technology skills through increased connectivity. So 75% of people over 65 years of age actually go online every day. So we would definitely want to encourage increased connectivity for older adults. Older adults have actually shown to be really eager to learn new technology skills. Particularly motivated when to use these skills when there's a need, and there's definitely a need right now. So spending a little bit of extra time, maybe teaching them or directing them to some online resources that can help them learn how to use online systems could be really helpful and beneficial for them. Since the pandemic, numerous intergenerational programs have actually emerged. So one is called Students to Seniors. There's a program where students and older adults can engage in virtual conversations. And then there's another one called Zoomers to Boomers, which is an intergenerational grocery delivery service. Another way to confront these challenges is to try and improve the quality of life for older adults. So renewed energy to combat isolation, learning about what gives meaning and purposeful engagement. So kind of helping them learn what gives their life meaning, what makes them feel purposeful, and kind of helping them find outlets and different ways to increase their activities. Increased awareness about the importance of advance directives and other legal documents. So definitely having the conversation with them about having those things prepared. And then also expanded workforce specializing in aging. So there's been an upswing in the interest among professionals across multiple disciplines to work with older adults and issues of public health. So hopefully this will continue and more people will be wanting to work towards helping the older adult population. Students and professionals across multiple disciplines have or may express more interest in working on issues of an aging society as well. So some tips to help loneliness for older adults. Social isolation among older adults is a serious issue, especially during the COVID-19 pandemic. According to the CDC, 1/3 of adults aged 45 and older feel lonely. So here's just a few kind of simple tips for some older adults to kind of help combat that. Send an email to a friend or even a letter if you're not really good with technology. Find a new good book to read. Share memories. So kind of go through a photo album, maybe send some photos to an old friend and talk about the time that you spent together within those photos. There's also online workouts you can do, or again, if you're not super technology savvy, there's a lot of DVDs, or if you still have VHS, there's a lot of tapes out there that can help you do a workout at home. There's also ways to volunteer online. You can also host a virtual get together. If you are pretty savvy with your computer, you can host a virtual get together. You can use Netflix to watch a movie with friends. You can use Zoom to kind of get together with your friends. Or you could even take this time to teach others your skills. So you could video yourself doing something that you like, whether it's gardening or knitting or whatever the case may be. Video it and you can upload that or share it to friends to help them learn some of the skills that you have. So just in general, what are some ways that we all can make a difference during the COVID-19 pandemic? So make sure that you are washing your hands, wearing a mask, avoiding crowds, maintaining a 6 feet distance apart from people, um, trying to save as much PPE for those who are on the front lines. Definitely make sure you have your mask though. Donate blood and plasma. Make sure that you're following food safety guidelines and make sure to report any fraudulent COVID-19 tests, vaccines, or treatments that you see online. And if you would like to check out any of these websites, they are linked here. And so I hope you enjoyed this presentation and I hope it helped you kind of give some insight on what our older adults are currently going through and kind of projected outlooks for what our older adults may be going through and some ways to combat the challenges that they'll be facing.